just a little background about me, very, very quickly. I know you've read my bio, and give context of how I came into the work of hoarding disorder. So my background, I'm a nurse in both mental health and physical health, but also a specialist practitioner in cognitive behavioral therapy, IPT, and EMDR, and also interpersonal psychotherapy. Okay. So how I became involved in hoarding disorder was in the late 90s when I was working in private healthcare. I worked in the National Health Service. As part of my training placement, we ended up having lots of referrals of family members bringing individuals in with hoarding issues. It was unknown to us what it was. We obviously treated them with the OCD model, which was the outcomes were very, very poor. People were relapsing, people were not understanding as the disorder as such. And I happened to be invited to do a radio interview many years ago, in about 2004, 2005. And as a result of that, there was a great demand of individuals wanting to understand about hoarding disorders. So then I set up a national treatment group in 2005, which has currently been suspended due to the COVID situation. So we used to run a monthly group, and it was open to people throughout the country, would come in for treatment. It was not a support group as treatment. And as a result of the work we did, we then wrote, I co-authored a book with my colleagues called Overcoming Hoarding. So today's session is going to be based on that as such, okay? So I'm going to start off by sharing screen with you all about on the presentation. Okay, I've done my bit. So the aims for today is to understand of hoarding disorder and its presentation, and appreciation the need to be flexible and creative in working with adaptive techniques. So this is something very important as clinicians, as scientific practitioners. We have to be adaptive, we have to be flexible. We cannot be rigid in the way we work with individuals. So if you think about your own clinical practice, think about how sometimes you have to work in slightly different ways in order to engage individuals as such. I will do this presentation for about 40 minutes, 45 minutes. That leaves for us about 15 to 20 minutes for questions and any other queries that you might have. Okay. So let's start here. Okay, so first of all, I just want you to have a look at this. This is a typical image, these are typical images of individuals who've got hoarding issues as such. These are images from individuals that I've worked with over the years. When I go into their homes to help them with their work, this is what you would see. An environment that's very, very cluttered and is no longer functional for the intended purposes as such. What do we understand of hoarding disorder? First thing I think is very, very important. The old concept is the way of life. People have made a choice to live that way. None of us would choose to live that way. It is not a way or choice of life. I think that's very important to hold that in mind, because quite often the way people's attitudes and engagement is that, oh, they've made a choice, they want to live that way, but it is not how someone would want to live. People have an awareness, but lack the understanding of their problems. Lack that their behaviors contribute to the hoarding issues. What is it that they're doing to keep it going? I don't like to use the term, have lack of insight, because that's quite derogatory. Generally, people have an understanding, but they find it difficult to conceptualize it. Okay, it's complex. Hoarding disorder is a complex disorder. It is you will have to look at it at multiple layers. And also, it has comorbid conditions with depression, anxiety, OCD, psychosis, and of course, personal factors, which adds to the complexity. Now, if you think about diagnosis, there are two diagnostic criteria. We have the DSM-5 and the ICD-11. The DSM-5 included hoarding disorder based on some of the research that we did, early research in 2010, looking at separating hoarding disorder from OCD. So you do have patients, individuals, or service users that would have presenting hoarding issues with OCD, but you do have individuals with pure hoarding disorder have got no OCDs. And I'll point out some of the differences there. So the DSM-5 included it, separated from OCD, and included it into its own diagnostic criteria. And that has been the main force in pushing for more research in the area. As you know, conditions where when they are part of a symptom of another condition, it tends to be overlooked. Here, having its own sort of separate identity has actually fueled more research in this area. DSM-5 also remove hoarding disorder from the obsessional disorders umbrella. ICD-11 actually brings it back into the obsessional spectrum, which I think is helpful, because then we can sort of think about treating people both for the hoarding disorder and OCD. In the United States, it tends to be, if you've got hoarding, then you'll be treated for hoarding, but you have to meet the strict criteria, and there's a very small percentage of individuals that would meet that. And then DSM-5 will exclude anyone with comorbid conditions like OCD, autism, and that will not meet the diagnostic criteria. So they're two contrasting points of view, but they complement each other. And I think it's important as clinicians to think about how these two diagnostic criteria work, or how they are developed, because it gives you an understanding about, they are not just written on the back of a piece of paper. A lot of work goes into the DSM-5, for example, takes about 15 years to an updated version. So the DSM-6 will be out in about 10 years or so, because they look at all the research, and there's a good developmental history into conditions. Okay, research into hoarding disorder. So the first bit of research we have is from 1993, Randy Frost and Gross, in part of their OCD clinic, started noticing individuals with OCD having, a lot of possessions. They seem to be overcluttered, the environment will be overcluttered. And then Frost and Hartle in 1996 developed an OCD model for compulsive hoarding. Gail Scatity and Frost started doing some work in the area in Boston, looking at developing a manualized CBT treatment for hoarding, but no significant changes. And the gains that were gained in therapy were lost at follow-up. So when they had follow-up at 3 and 6 months, people were already beginning to re-engage in their previous behaviors. And then also David Tollin, Frost and Scatity went on to do a bit more studies looking at the economic and social burden based on the internet surveys. Now, I find internet surveys very difficult because it's very hard to monitor and actually find so this person's, do they meet those criteria? But what they did find was that, there was a high cost in dealing with hoarding disorder, and families were burdened by it. Wilbraham, another, is based in the UK with Steve Callett. One of my colleagues did another study looking at partner and carer perspectives. What was the impact on family members who have other family members either living with them or living externally who had hoarding issues? Saxena looked at the future direction in hoarding, because we're trying to understand what it is. One of the things was looking at the interventions on information processing. Are they able to process the information? What are the decision-making deficits? What actually happens? How do people, why do individuals find it so difficult deciding what to discard or to keep, and organizational skills? And then further studies, they did also another study looking at Frost and crew, excessive acquisitions, where people were just bringing things in, where we tend to pick things up. We want things, we bring it in, even though it may not be something that we intend to use immediately. Grisham started looking at categorization deficits and cognitive deficits with people with hoarding issues. And Tollin did an open trial, looking at the in terms of CBT-based treatment, and with a lot of homework that needs to be done. And also what they did find that there was improvement at 1 year follow-up. And then Frost et al. Looked at bibliotherapy, book-based support group. So people work through a workbook, that they used. They carry on doing the work. They had the support group and they saw them face to face, and then carry on doing the work at home. And AS in 2012 found that CBT was not fully effective. And I think this is something to hold in mind about, we can't think of one treatment modality is going to be adequate as such, okay? And then one of the studies done by Chen looked at, between hoarding and OCD and in women, found that poor maternal care actually led to people starting to hoard. And I think that starts getting you to think a little bit, what is that about? When we think CBT is not going to be effective, and then maternal care, what is it about people's bonding issues? What is it about being cared for? What is it about interpersonal aspects of it? Levy in 2017 looked at changes in saving beliefs about the need to keep something. Why do we need to keep it? And then the improvement, and working on the beliefs did bring about some improvement. Chow was also looking at, let's move a different direction again, not just pure belief-based work or behavioral work. We need to think about compassion, showing some kindness. How do we bring about compassion in treating people, or people developing compassion towards their hoarding issues, and work with that. Matthias looked at the attachment theory integration. I think this is another thing to start thinking about the attachment, going back to the previous study about poor maternal care. We need to think about the attachment issues there. Yap and Grisham looked at the object attachment and hoarding disorder. Why do people develop attachments to objects? And then Roberts looks at the barriers to treatment and treatment delivery. What is stopping people from getting, treatment? One is a lack of understanding by professionals not having the understanding or the skills or the knowledge base how to treat with individuals with hoarding disorder. And also the other thing I think is very important is about attitudes, individuals' attitudes towards hoarding. Okay, there are lots of small scale studies. Again, we need to think some of the studies are very small because of the sample size. It's very hard to get people to be involved in studies compared to randomized control trials, which have got very large, the gold standard large studies. And here we have to pick up some of the lovely work that's been done on these small doctoral studies and PhD studies. Okay, prevalence. It is estimated less than 1% of the population hoard, but I think the true figure is higher. Pertusa, who I've worked very closely with the first study that we did in the UK, looking at brain imaging of individuals with hoarding disorder, estimates between 2 to 8%. And this is usually based on self-reporting, individuals reporting themselves. So individuals who don't identify themselves as having hoarding issues or don't understand it, they have a problem, but they don't know how to label it, will not be reporting it as such, okay? Recent epidemiological studies meeting the DSM-5 criteria estimate it's about 1.5% of the population, both men and women. I think very much so the true figure is much higher than that. If you think about it, each of us individually have our own hoarding tendencies. We tend to keep things which are significant to us, and we can certainly discard, but that doesn't become a problem, but we have a natural tendency to hang on to things which are significant, okay? And also what is very, very important to remember, there's no distinction between age, gender, ethnic group, educational and socioeconomic status, or occupational tenure. So whatever they are doing, people have got hoarding issues. If I was to ask you all, just very simple thing, how many of you all keep your text messages, or how many of you all keep your emails or cards that friends send you? So you can see we all have natural tendencies to want to hoard. Looking at in terms of, I have lots of queries from individuals from Japan, who is a major problem in Japan, hoarding in terms of the environment space is so tiny, the apartments are very, very tiny, and people tend to be quite minimalist in Japan, but there's a big problem. So its culture doesn't have an effect of it at all. Okay. So one very simple way of looking at hoarding disorder, we want to look at it, is excessive collecting and saving. So people will collect it and they save and they can't discard it, they find it very hard to discard. So if you ask yourself, sometimes you might get a text message from a loved one who says, oh, I love you, I care about you, I miss you. To delete that message becomes very, very difficult. You find that, oh, there is an attachment of some sort, okay? The perceived need and instrumental value of the item. So this item will be important to me. I will need it. This pen, for example, this brush, I will need it. It'll come in handy. Oh, even if I don't write characters with it, I could use it for painting. I could use it to do some other bits and pieces, okay? And also the beliefs around each item has got a life of its own. It's there to fulfill the purpose. Perceived distress experience when parting. Oh, if I lose it, it'll be terrible. I won't be able to cope. Okay. Now, what is really interesting, people with hoarding issues, for them to deliberately part with something is difficult. If there was a fire, they're fine. Or someone breaks in and steals their items, they're fine. And that is also very much about they did not make that decision. That decision was taken away from them. So again, the sense of responsibility, I might make that wrong decision. Okay. Beliefs and sentimental attachment is significance to items saved. So for example, a family member gives you an item and you say, oh my gosh, this piece of jewelry, is given to me by my grandmother. So it's very, very important. I want to keep it. So this is significant. The beliefs around them that people hang on to. Say, for example, in house clearings, family members who've passed away, I can't throw that away because, for generations we've eaten from the same crockery and stuff, okay? And then we have, and what are the most important bit of the definition, I think it renders the space from functioning for its intended purposes. So for example, a kitchen is no longer being used as a kitchen. A bedroom is no longer being used as a place to rest or sleep, okay? Impacting on the individual's functioning. So the person is no longer able to cook in it. And then the socialization and quality of life is deteriorating. A very good a movie to watch, a documentary that was done in the United States called My Mother's Garden. It's a very, very interesting story about how this woman whose children came in to clear out her home, but her home was no longer functioning. She was actually sleeping in the garden. The house was cluttered. So she was actually sleeping outdoors, and how the family come in and the impact of it on her. Assessment for hoarding disorder, standard CBT assessment, key emphasis is that engagement in any condition that you're treating with, you want to be able to engage. I always say to my trainees and my students, it's very much, if you do not have the ability to engage, you may have 10 degrees after your name, it has of little value. Where possible, carry out the assessment in the home environment because it's very useful, because you can get to some of the core cognitions in that. It also enhances the engagement that the individual is willing to come to my home, and it enables a comprehensive assessment, and it helps in identifying goals, the beliefs about objects. Why is it that you're keeping this? Show a degree of curiosity, wanting to explore and find out, rather than judgmental things. Why are you keeping this? It's about, oh, what makes you keep this item? And then looking at some of the emotions and the behaviors associated with the collection. And where it's not possible due to logistics or patient consent, use creative methods, use photographs, use visual methods, getting them to bring items from their homes, because that can be really useful. If I asked you to get rid of this item, what happens here? What are you experiencing? What are you feeling? What are your thoughts around that? Yeah. Okay. Key consideration, you might want to look a little bit about the childhood factors, family relationships. So we look at some of the research has shown, attachment issues, maternal bonding issues. We want to think about what might be the connection there. Trauma is a big area of people developing hoarding tendencies, because it's about feeling safe, keeping the environment packed. They feel much more safer. If you think about PTSD and OCD, again, those checking behaviors, they become part of the condition. Loss issues, again, people coping with their loss, hanging on to items because it is quite comforting. Low self-esteem. Interpersonal issues, they're not able to form relationships with people. And whereas this object, this cup, will not talk back to me, will not make me feel upset, will always be here. As long as I look after it, it will be here. It'll give me comfort for years to come. The trust issues you want to think about. People have had lots of negative experiences in life, especially with hoarding, neighbors complaining, family members complaining. So that's about trust. Relationship with the item, meaning of the item, history, significance, challenges, attachment, and then function of the item as a means of coping mechanism. Overvalued ideas, beliefs about the item. So this cup is there to function. There is a purpose for it. It has to fulfill its function. Okay. And then beliefs about recycling. Now that's added into the complexity because we do not want to waste. We want to recycle to make sure they discard it in a proper manner. Measures. There's a set of measures that are available out there. You can download from the internet. The saving inventory advice measure is 23 items. But you need to think about when you're using measures is to reduce the burden on the individual, because measures are lots of items. I tend to use the hoarding rating scale. It's a 5-item measure. Both can be used by the clinician or it's self-rating. It's very easy, very standardized. And then the compulsive acquisition scale, 18 items. Home environmental index is just about assessing the level of squalor. And clutter rating scale is a visual scale. And photographs is very useful because I think it's more powerful. Anything that's visual is going to be more powerful for recording and monitoring progress. Formulation, standard CBT formulation, the foundation therapy engaging the individuals. It must be collaborative. It must be shared. However, it's important to think about the intended and unintended consequences for each element. So it's just when you do behavioral activation, you're thinking about the intended, unintended. So the intended consequence is keeping this mark. The unintended consequences adds to my collection of 50 marks. Okay. The behaviors, the emotions, the beliefs, and I tend to use the vicious flower formulation because that feeds back into it quite nicely. Visual methods. Now, this is very important. It's both a research method to elicit individuals' experiences. It's a narrative based on photographs. It's called photo voice, but it's also can become a clinical intervention tool. So Catherine Wang did a study in China looking at women in very rural areas who had very poor education levels, who could not read or write. So they used photographs for them to narrate their story, telling the story. So it's extremely powerful. Okay, so when someone is able to see something, they relate to it very differently. It's both a research and an intervention tool, as I mentioned. It also gets the narrative, for people telling their story becomes an intervention, the power of the image. So if you think about counseling, people retelling their story, working grief, retelling what's the loss issues helps as a way of processing. And also it's about getting them to engage at a different level rather than just, understanding I have a problem, but a bit more deeper than that. The intervention, I'm going to start off with by going a little bit, I've made them very brief, but I'll talk through them. Vision. So when I'm working with individuals with hoarding disorder, I no longer go with goals. Now, goals are very difficult because goals are very defined in a way how someone would like to see. So, for example, in depression, it's very easy. What would your goal be? I want to be able to function better. I want to be able to be doing more. So you can measure that. You can sort of study how is it impacting measuring that. For someone who's had a hoarding issue, and that tends to be quite a long-lasting issue that's been almost lifelong, it's very hard for someone to have a goal because they know no different. They do not know what is it going to be like without. So I tend to use vision in a way is that if you were to imagine your environment, what would you like it to look like? How would you like it to look like? So I'm going to ask you all to do a very simple behavioral experiment with me for just 1 minute. I'd like to invite you all to close your eyes for a moment. I want you to visualize a problem that you have, a small problem that you might be experiencing. And then what I like you to do, experience that that problem, experience it emotionally, what it feels like within your body. How do you feel it? And then now what I like you to do, I like you to vision, how would you like to see that problem when it's solved? What would it be like? How does it feel like when that problem is solved, or when you've overcome that problem, or what would it be, the end product be, the image of the end product be like? What do you feel in your body? And then I want you to ask yourself this question: in order for me to feel that way, what do I need to do? Okay, that's all you're going to be doing. Okay, so hang on to that. When we come back to the questions and answers bit at the end, we can discuss this a little bit more further. Now, the HORD acronym 2. So this was a study that I did with my colleague, Colin Jones. This was one first study we did, again, using visual methods, because I wanted to look at the impact of impact of using images. So we came up with this. We got individuals to take photographs of their environment and then took them to a neutral environment, bringing in the photographs that they had taken of their homes. And then we asked them 5 simple questions. So it's with the initial HORD, what happened in this image? What actually happened? For them to tell you the story about it. And then O, what would you like to overcome? And what is your vision here? A, can you imagine a life without all this stuff? R, how is your life and relationships affected by this problem? And D, what would you like to do about it? So very powerful tool. And working in a neutral environment removes someone from the environment. So the first thing that we found when we got individuals to do this, they said, oh, these pictures, where are they from? I said, you brought them. I didn't bring them. You brought them. There's from your own environment. So there is this notion of clutter blindness, where people can't see. When you're used to an environment, you cannot see. It's like smells. When you go into a new environment, you go into a restaurant, initially you might smell it, you can see the different smells, and after a while, that smells blend in. So that's about smell blindness. So here, clutter blindness, so you know no different, because that's your environment, you're used to it. So that's you can't tell the difference. It's only when you go into a different environment that you say, oh, it's quite interesting. I've had lots of individuals who identified themselves having hoarding issues when they've gone into friends' homes and to help them, and they say, oh, this environment is cluttered, and then they look, my home is very similar too. Okay, so we found that people found this quite powerful tool to talk about their story and tell you about the story behind it, and also was very much about them recognizing that they have a problem, and then bring them out of their home environment creates this emotional distancing. So they are emotional distance, they're no longer emotionally attached, so they can have a more objective sort of experience and describing the problem. The clutter image rating tool designed by Frost, you can download it for free from the internet. It's an item using 9 images at different levels of clutter. Again, helping individuals to identify the level of clutter their room, their environment is in, and then using it as a tool to say, right, if you're at level 4 now and you want, which level would you like to get to? They'll say a level 2. And you say, okay, let's be realistic. We want to get to level 2, will take a bit longer. Let's work on something a smaller scale. Let's get to a 3.5. And what are the steps that you need to take? So there's a visual prompt, what it would look like for them to move from one level to another level, and they can sort of use that as a gauge as such. Okay. Color card, there's another tool that we discovered where we help people. Now we know a lot of individuals will complain that they have difficulties maintaining a focus. They have ADHD, or they have tendency of ADHD, they're moving away. And for ourselves, when we feel overwhelmed, we feel, in terms of your own academic work or items or work that you have to do, when you're feeling overwhelmed, we tend to distract ourselves, we tend to do other things. It's the same thing. When you're looking at an environment, you look at it, the level of clutter is so overwhelming, you want to do something else, you get distracted. So what we did was that we did a study using a color, giving people cards, a large enough A4 size card that is a color of significance to them, what it means to them. So what happens is that the cluttered environment will look very drab. So you place the card on the area that they're working. So it draws the attention, it keeps the focus on it. And also, I encourage people to write, if they want to write on the card, some statements or draw an arrow to just bring them back into that focus there. The grid. Now, again, when you're working in a very large environment, working in an environment, it seems very overwhelming. So we started to get them to look at how you break the environment into small sections. So as small as 1 foot by 1 foot square, 30 centimeters by 30 centimeters square, and working in that one area before they move on. We know when we do some cleaning, we do bits here, bits there, we don't see any difference. But if we work consistently in one area, you see a change taking place. And that's what we help them to use to keep that focus in working very small grids, and you incorporating the color card to keep the attention there. Now, in cognitive therapy, we tend to look at disputing beliefs. Now, it's very hard for people to sort of understand cognitions. What does it mean? I always say about what is it that you're saying to yourself? What is it that you're saying to yourself? How does it help you? So, for example, you and me, we might go and buy a shirt. So I might pick up this pink jumper and I look at it. I say, you talk to yourself. Oh, I think I quite like that. I'm going to a wedding soon. I could wear that there. We talk ourselves into it. Also, individuals would talk themselves out of doing something. So, for example, I used to run. I love running. And in the winter months, I'll be up, 4:35 in the morning before going to work, go and do a 50-minute run and, get dressed and then open the door. It's so cold. I said, oh, no, I'll do it tomorrow. It's too cold today. You talk yourself out of doing things. So this, again, the self-talk, if you think about behavioral activation, how people either talk themselves into doing something or talk themselves out of doing something. So getting them to attend, and you want to use the self-talk in a constructive way. Okay, 10-second rule. Every item that they have, they only have 10 seconds to make a decision whether to discard or to keep it. And also another one, I use the traffic light system, is into 3 piles, green definitely going, red definitely staying, and the ambers in between that they will revisit at another time. And then you want to look at the beliefs around the items. So here again, doing some basic cognitive therapy, working on their beliefs, working on this item. Say, for example, I worked with individuals who collected their hair because they felt that the beliefs around that, if I had my hair hold memories, and if I lose that hair, I'll not hold the memory. So I would pick a hair out and say, okay, now tell me what's the memory associated with that hair. There's none. They can't tell. I said, now can you see how you're holding a belief that has got no validity? So very simple behavioral experiments work quite well. And I think it's very also important to look at the attachments that people have on items, and working on the attachments there and developing healthy attachments outside of their home environment. Oops. So in conclusion, what I want you to think is that hoarding disorder is a complex disorder. Now, I know we have lots of theories and models there. What I think is very important to remember, you need to treat the individual in a very idiosyncratic way. It's their presentation. So I've worked with hoarding disorder for 20 years now, and not one individual, not two individuals are the same. Everyone has got their own unique presentation. Yes, we have common features, but it's different. So you have to hold that in mind. That's why I like the vicious flower, because it's very much built within the concept of that person's understanding what's happening for them, their beliefs, their belief systems. Now, when you do a formulation or conceptualization, don't use forms. Just draw it together much better. It just creates that sense rather than it becomes too mechanical when you're filling in boxes as such. Okay. I think you need to think about the person. You're working with an individual. Work with that person, not their condition. So you need to think about the respect you show to the individual, the concern, the sense of curiosity about their problem, being very non-judgmental, not making critical remarks. Again, thinking of constructive language, not using words like why. Why is deconstructive. It's like blaming. It's like, what makes you do that? What makes you collect this? Tell me more about it. Show a degree of curiosity when you're working with an individual. You need to be creative. and innovative and engaging them into therapy. You know, whether you're going down the route of CBT, you're going to bring in some concepts of interpersonal work, you're going to bring compassionate focus. Again, when I do a formulation, I tend to be making it very compassionate, so getting to say, if we understand why you've developed this this condition, we understand where it comes from. You know, be kind to yourself. It's your way of coping and dealing with quite a stressful life that you've had. It's your way of dealing with the loss issues that you've had, or the trauma you experienced, for example. It's rather than blaming, it's about helping them understand. Now let's look at how do we move away from this? How do we deal with some of these issues? Use imagery, visual methods, powerful tool to aid engagement and therapy in clinical setting and home settings. I think it's very, very powerful. If you think about yourself, if you use imagery work, I do a lot of imagery work, I use a lot of visual stuff, which is more engaging for individuals. And then you want to treat comorbid conditions as it simplifies the complexity they're presenting. So here, remember I mentioned about, let's say someone is presenting a presentation of OCD and hoarding. I would treat with the OCD first before I touch the hoarding issues, because their belief systems, the OCD belief systems, will actually interfere with the work with hoarding. So for example, individuals who have got a good example to see people with hoarding issues and OCD, a very good simple rule to see whether there's OCD is that the items that they save. Generally, people tend to save magazines, newspaper, receipts, clothes, books. That's the general thing. But if people start saving things like hair, use sanitary towels, use dental floss, feces, which is common, not uncommon at all, I've seen that. Then you know there's an OCD element around that, because it's the beliefs, the OCD beliefs, that maintain the hoarding issues as such. And then, yeah, so I've done it in about 40 minutes, leaves us 20 minutes of questioning. I hope you found that useful. Please, first of all, before we start the questioning, I just want a couple of people to share the experience of the little behavioral experiment I did with you all for that 1-minute behavioral experiment. Would anyone like to share that experience with us today?
Yes, folks, feel free to unmute your mic or just indicate in chat.
Yeah. I'm with you all now.
All right, we have got 75 people apart from us two. Anyone religiously did that behavioral experiment?
Did anyone give it a try? We just did it very quick for a minute. What was it like? What was the experience like?
Is it okay if I did it for a problem that wasn't related to hoarding at all?
No, nothing to do with hoarding. I was just saying a personal difficulty. That's it. Yeah.
Yeah, sure. I can share. I did the exercise. I think it was interesting because it brought up, I think, feelings of difficulty. I think the problem I had was setting boundaries with my family. Yeah. So I think when you asked to visualize the problem, you could sort of like feel like the burden. I could feel the burden on me when I was doing it. And when I visualize sort of trying to get to a better place and what I need to do to get there, I think I can feel my body sort of feeling lighter, but also it was also, I think, the dread that comes with communicating boundaries. Yeah. So that was sort of the feelings, my body and my, I guess that what the emotions I was feeling as I was going through the exercise. Yeah.
Okay. And then when you ask yourself the questions, what do I need to do? Did that help you at all in order to feel differently?
Not really, in a sense, because I think I knew what I needed to do. I think maybe it reminded me of why I wasn't doing it. Like what was holding me.
Okay, so it's quite helpful in that way.
Mm-hmm.
Yeah, good. Thank you for sharing. Anyone else quickly? Anyone else tried it out?
Satwant, there's one in the chat. It's from my colleague June, who said, I imagine the feeling of shoulder pain that I'm experiencing, and it felt good to imagine that the pain's being relieved.
Okay, and then in order for it to be relief, what did you need to do? Did you ask that question? Because what happens is that when you shift the emotional aspect of it, it sort of gives you an idea what some of the things I need to do, whether I need to rest it, whether I need to have physiotherapy on it, whether I need to do something on it. So something to think about that. Oh, someone has said to repeat the 1-minute exercise. Okay, I did ask the question. It says the answer was exercise and physiotherapy. Okay, so this is something for you all to try at home. What I'll just repeat it. You don't have to do it now. Is that, or you can work with your patients and try it out. Also, there's no harm in it. So you can look at the current difficulty you may have. And what does it have? What impact does it have emotionally on you? How do you feel emotionally about it? Then you think, how would I like it to be different? How would I, say, for example, right, I'm overweight at the moment because of COVID, haven't been doing much, sitting around too much. And then, I would say, oh my gosh, I feel overweight. I feel very uncomfortable. And then I imagine how I would like to look like, maybe going back, 18 months, what I look like then. I say, oh, I like that. So what comes up for me when the feelings that, oh, that feels a good place. I think of all my clothes I can wear again. And then I start, I need to start going back to spinning. I need to go back to the gym and start exercising. Those are the steps that come up. Okay. Okay, good. Right. And it's good. Someone said the exercise helps me to be more motivated, makes change. And that's true. You do that. Okay. Any questions? Anyone has any other questions? Yes.
Satwant, Amiral here.
Yes, Amiral. The Amiral is my colleague. He's my clinical lead.
I'll just put the camera on, just say hello.
Yeah.
Thank you so much for allowing me to be here. It's really interesting. I was just going to say, whilst I was doing the exercise, how easy it was to allow myself to not experience the emotions that comes with the negative kind of environment. So I was just going to suggest that really, just how powerful it was, just to allow myself not to think about the negativity and how your body experiences that. It's quite interesting.
Yeah. Okay, good. Thank you, Amiral. Okay. So now,
Satwant,
yeah,
there's a question that came in to me personally, asking for a quick demonstration on vicious flower.
Okay, right. Let's see. Okay.
How would you do like questions?
Okay. Yeah. So a very quick question I would say with the vicious flower is that at the center of the flower, I always let me do this on a share screen, shall I? On a whiteboard. Okay. So always in the center of it, I will say, my hoarding. And I would say, what does it mean to me? How does it, and the impact? So I always put this in the middle here, because what happens, this is the center of the flower. In looking at, you get a good definition. So for example, my hoarding would be, say for example, my table is cluttered. I'm no longer able to use my table for eating my food or writing or doing any work, okay? And then I get them to think about what are some things that happens there. So for example, I would say here, collecting items, okay? Then I get them to break it up. What is the intended consequences? And the unintended consequences. Okay, so sorry, spelling mistake there. I can't see because there is the, okay, that's better. Unintended consequences. So here I would draw out an arrow that goes out there. And then say, for example, they might feel uncomfortable. So discomfort of the environment, say, for example. Oh, they feel comfortable having the items. So then again, that is one of the consequences out there. And then you look at the feeling comfortable with the items, you look at the intended consequence of keeping the item because it gives you relief, but the unintended consequence, you end up having a clutter there. So then what happens is that with this, as you question them, those simple questions, okay, so yeah, your intention is to keep the items, you collect them because you feel that you need them, but then the unintended consequences is that you end up keep having them, so you can see how that fuels back in again. So you draw back the inward the arrows going in. So simple questions, I will ask them, what is it that you're hoping to gain from that behavior? And then what is it that you're getting from it? And what happens as a result of engaging that behavior or dealing with the emotion or your beliefs about wanting those items, the beliefs that you hold? How do they help you? Does that help at all? I did a very quick demonstration in terms of the vicious flower. So you put in all the other behaviors and emotions and beliefs around here and build it into this center bit here. Yeah, was that helpful?
That made sense to me. Yeah, Josh said yes. Hu Yin, the one who asked us, I hope that's clear.
Yeah.
And another question just came in. Yeah. Sorry, Satwant, carry on.
No, carry on. No.
Oh. I keep getting direct messages. Folks, you can actually put in the chat where everyone can see if you don't mind. So I'll read this one out. When would be a sign where clients would be ready for the 10-second activity?
Okay.
What if they kept saying yes to all items?
Yeah. So one of the things that you would say to them, actually, you would stop them quickly. If you're working with someone and you want to bring that in very quickly because you're going to help them to start discarding. If they're saying yes, they want to keep to every item, then you would stop and say, what are you saying to yourself? What self-talk is taking place there? What is it that you're saying to yourself that makes you keep all those items? Yeah.
All right, great. Any more questions? Deepa is asking, do you need them? Would that be a question that you ask?
Oh, yeah, you could ask them, yeah. And what, do you need it? How likely are you going to use it? So quite often, let me ask you all, how many of you all, just put up a show of hands, you all can put up, or you can just type in there yes or no. How many of you all have cookbooks, books on cooking? Good Malaysian food, cooking traditional Malaysian food, for example. Yeah, okay. So Alvin, I'm going to ask you this question. So you have all this good cooking food, good Malaysian food, good traditional Chinese food, good Indonesian food, whatever it is, okay?
Thai food.
Yeah, Thai food, yeah. How often do you use those cookbooks?
Almost never at all.
Precisely. So that's a simple question. I said, right, you have all these cookbooks. Does that mean you don't cook? You can't cook. If you went into the kitchen, would that mean you would not be able to prepare food without the cookbook? So this is a simple question to ask. I think you're right. Do you need them and how likely you use them? How likely are you going to access it? And when was the last time you looked at it? So I gave away about 100 CBT books because I realized, you know what? I have these books. I took them to work. I said, here is a resource if you all need to use them, because I bought all those books. They look nice. They seem interesting, but I never read them. I said, someone else can use them. It was never been used. There's no point keeping all of those things there. So it's about how likely. And I say, when was the last time you used it? When was the last time you looked at it? Yeah.
Right, great. Don't see any other questions coming in.
Yeah.
Yeah, feel free to unmute as well. I think Amirul.
Yeah, Satwant, I was going to ask, in the beginning, you spoke about overvalued ideas. I was going to ask, are the themes of overvalued ideas both with possession and giving up possessions? I know you kind of specific, but generic.
So it's about possessions, it's about themselves, about their role, about keeping those items. They become custodians. It's about the safety element. It's about feeling safe and secure if you have those items. It's also overvalued ideas about memories. If they have the item, they have the memory. So a lot of people, we take lots of photographs, we keep photographs because we forget, or we go on holiday. Let's say you went to Bali and you bought some item from Bali to remind you, oh, I went to Bali. Do you really need those items as a memoir aid to remind you? I would say to them, how often do you look at your photographs? How often do you think of your parents without looking at the photographs? You know, you do. Even though your parents may have passed or your family members have passed, you always remember them. It doesn't affect that as such, yeah. Yes, so for example, there's a question from Joan. about having a dementia affect hoarding disorder in the elderly? Yes. So now there is a condition, not condition, is a descriptive term, Diogenes syndrome. Has anyone heard of that before?
I've heard of Diogenes, one of my favorite philosophers.
Yes. So Diogenes syndrome is a description. So you will see some research papers on them talking about it. So it is not a condition. So Diogenes syndrome is basically people live in squalor and clutter because they have a lack of awareness. So people with dementia will probably, you can describe as having a description of Diogenes syndrome rather than hoarding disorder. Is because of their dementia, it impacts them. So if you look at the DSM-5, dementia would be one of the criteria to exclude hoarding disorder, is because of their mental capacity or ability to engage here. Yes, e-clutter. Yes, definitely, it's a big issue in terms of people, hoarding items on. It's lesser of the two evils in a way from the environmental. So a lot of people now, part of their cluttering work, they move to e-clutter, where they take photographs of the items and save them on a hard drive or an external drive or on the web, so that they no longer have the physical quantity. So something that helps people also when they're discarding things as a memory, they'll take a photograph. I've thrown so many bags out, and then they said, right, that's something I know it's gone, but I still have some connection with it. Yeah. Suddenly, I think sometimes when people's mailboxes are full, you get this message, my work emails, I think there are about 11,000 emails, and occasionally it says your mailbox is getting too big. Yeah, and Emerald came in one day and looked at my mailbox and said, my God, you've got all these emails and not been read and not been deleted. Yeah. Okay, so the likelihood, yes, people won't engage because they don't understand. What do you need to do? A lot of psychoeducation to help them understand about the problem, and especially using curiosity, using Socratic questioning, getting to look at the impact of what they're doing and their environment, and how it's impacting on their day-to-day life, and how would they like things different. It's just, you want to create CBT, cognitive therapy, is about creating a dissonance. So you want to create a shift. That slight shift helps them to refocus and rebalance, and that's what you want to be working towards. Yeah. And then also the risk about force clearing. Now, force clearing causes more distress. So you need to think part of the reason why people hang on to items is to reduce the level of distress, to feel safe and comfortable. So what happens here when people have force clearing, where without their consent, without their involvement, they become more distressed. As a result of more distress, more items come in, people will hang on to things more. Here, in the past, we used to have environmental health, would do a blitz clean of someone's flats, everything is removed. Within 2 weeks, it'll be filled again, because people need to feel safe and comfortable. So no one is working with underlying issues or giving them new coping mechanisms. And as a result, they end up bringing more stuff and recluttering the environment. Yeah. I think it's not prevalent in certain personality types. You will get them across the range. Yeah. Right. How long process? Again, it all depends on individuals' commitment to work. It can be a very slow and tedious process. I've worked with individuals that have done amazing work in a very short space of time. It depends on the level of motivation. So you want to work towards that. And also, it also depends on how easy is it, or how much support an individual has. So sometimes, quite often, using family members to help them can be helpful. So you get their consent. Always get consent. Do not involve family members without consent. Always get consent. Involve family members. Psychoeducate the family members, not about discarding. It's about working with the individuals to provide support. Sometimes all the support they need is someone being there with them rather than throwing things out. And again, you might think, yes, quite often people will keep things for future intended use. That's the standard. And all I would say is that I would ask them, how likely you're going to use it? If you didn't have it now, how likely is it? How difficult is it to get it? So now, for example, journals and articles, you don't need to keep your journals anymore. You do a search on Google or Google Scholar, you can get the information. So again, it's about using that sort of logic and arguments with people, you know, like say, for example, you don't have a cup, doesn't mean you'll never be able to buy it. You go to shops, you can get them the quite reasonable price, and how likely you're going to use it in the future is a good thing. Yeah. Any other questions? We've got another couple of minutes before we end.
I think this one by Hun Feng. How do you create awareness in a hoarder?
So you create awareness is about, you know, again, is using Socratic questioning to look and to question and say, now, how easy is it to walk in your environment? How easy is it to use that? Does it cause you problems? Are you concerned that you're going to fall? Can you bring people in? Can you invite someone into your home? Quite often people who have very cluttered environment won't invite people in. They tend to be out a lot of the time because, you know, or they are frightened if someone gave them a lift, someone say, oh, can I pop in and use your toilet for a minute before I make my journey? They cannot let people in. So you start getting them to think, is that an issue? You also can get them to look at some YouTube videos on hoarding to say, you know, does that resonate with you? Does that make sense? It's not about, we're not blaming and things like that. Yeah. And there's a question.
Last two questions I think we can take. Yeah. How real are the risks of suicide and self-harm?
The risk of suicide I've never had a risk anyone commits suicide with hoarding, because if they do, it's because of depression, but because of hoarding, they do get depressed, but they do get distressed, but not to that level, because they also understand, you know, it's out of their control as such. Unused memberships, yes, it can. It can be. I've got some gift cards which I forgot to cash in, and they're like 2 years out of date. And I said, oh, I might go and get them back. I might go and get to use it. Yes, we do. People hang on to those. Yes. Animal hoarding is a slightly different category. The belief system, yes, people do hoard animals. It's about the welfare of the animal, about one. So it's a very different belief system. It's about the well-being and easier to treat if you can reassure someone that the animal is going to be homed well or going to be moved somewhere else. People engage better. But generally, it's about people's beliefs about, you know, life, animals' life, and what animals deserve. Yeah.
Okay, it's 6 o'clock here already, and it's 10 over there, I guess. So
very quickly, I'm just going to do one last one from Will Leong. Will, yes, it's a big risk of fire, and it's a very good motivator when you say to them, you know, look, your home is environment. This is my home. Yeah, but if there's a fire, other people will be impacted. You know, other lives may be impacted, and people tend to want to engage with that. So I hope it's been useful, and that's something for you, gives you some food of thought to deal with some of, if you get a presentation of hoarding, maybe might be quite useful to put in some of these ideas for ourselves, because we all have hoarding issues, that's for sure. All right. Yes. Thank you, everyone. Thank you for joining me today and making the time to be here. And thank you, Alvin, for organizing this.